Cancer is a very complex disease. Finding underlying problems of cancer is key for early intervention. By finding imbalances in patients with known diseases, it's not only possible to improve standard treatments with drugs, surgery and other pathways, it's possible to improve their outcomes and better monitor the activity of their disease. By doing inflammation panels, by balancing oxidative stress problems, by decreasing the levels of acetone ammonia in diseases, by reducing patterns of volatile substances, aerosolized substances which are known to be linked to diseased states, we can monitor individuals' therapy to form best practices for complementary care. In cases of cancer, for example, cancer is associated with genetic as well as environmental factors in its pathogenesis. Using social networks. By using social networks to reach large scales of people, by using breath analysis, evaluation by urine, serum, blood blots, body fluids, saliva, tears, nipple aspirate fluid, we can monitor these imbalances at toxic levels and patterns of a disease on an individualized basis to see how they can be best treated. This may include methods of balancing a Chi with acupuncture followed by certain antioxidants that are linked to markers that are known to improve outcomes, such as green tea in breast cancer. Broad-spectrum antioxidant activity may be more effective than high-dose monoantioxidant therapy. Using markers for individualized home testing, this will be the future of cost-effective cancer prevention, detection and therapy. By following patterns of these toxic substances and markers that are known to be associated with disease, we can check an individual's response on a daily or even monthly basis very inexpensively with home testing. In addition, patients could monitor with this method of treating disease and diagnosing diseased states associated with diseases by exercise, diet and lifestyle changes such as weight loss, decrease alcohol intake, to then better monitor their health status. Traditional diagnosis of diabetes. One way to make a simple diagnosis is a random venous blood sugar over 200 mg/dl. The diagnosis is established if the overnight fasting glucose is 126 or greater. Levels between 110 and 125 are elevated and need to be repeated. There are conditions that cause polyuria and polydipsia like urinary infections, heart failure especially with nocturia. This does not mean these conditions are indicative of diabetes, they need to have an elevated blood sugar. Once the diagnosis diabetes is made, the condition continues, even if it is controlled with diet, weight loss and exercise. The American Academy of Clinical Endocrinologists has set guidelines for target sugar levels for diabetes. 2 hours after a meal should be under 140 mg/dl. The A1C should be under 6.5%. This is a blood test that is a marker for how the sugar has been doing over the last 2 to 3 months. Diabetes can cause complications to all parts of the body. The most well-known complications are disease of the kidneys leading to renal failure and dialysis, heart disease, eye disorders including blindness, elevated blood pressure. Screening for diabetes in high-risk patients is needed because many newly discovered cases of diabetes are not aware that they have had diabetes for years based on 35 years of taking care of diabetic patients. The costs of diabetes have recently spiked for each patient as well as the rapid rise in numbers of newly diagnosed cases of diabetes. Diabetes affects the way the body uses food for energy. The body is made of billions of cells. Insulin is needed for this conversion of food to energy. Diabetes is a disease where the body does not make insulin, or it is unable to utilize the insulin that is made. The sugar floats around the bloodstream and cannot get inside the cells where it is needed for cell metabolism. It does a lot of good in the cells and it does a lot of harm when it is in high levels in the blood. Problems with traditional therapy of metabolism that relate to cancer. Blood sugars are difficult to regulate and monitor. There is a lag time in the release and use of insulin. Different foods, activity, etc. change the blood sugar rapidly. Tight control is difficult and does not stop the progress of complications. Low sugars have recently found to be frequent in almost all diabetics. Benefits shown in treatment with artificial pancreas therapy that is discussed in my first book on diabetes titled Find and Stop Diabetes. These include better blood sugar control, proper hepatic metabolic activation, less incidence of brittle diabetes, controls more than just the blood sugar, prevents the formation of acids in the body and other harmful metabolites. Incidental benefits noticed in some cancer patients.